Hi, my name is Beverly Carter. I am a BSN RN, and I'm going to talk about pain management using cognitive behavioral therapy. I currently work at a substance use disorder facility called Grand Recovery in Tulsa, Oklahoma. I provide care for patients suffering from pain for many different reasons, acute and chronic. My patients are also battling addiction. They're in the recovery and recent recovered phases of their treatment. There are many different treatments available for pain management, being pharmacological and non-pharmacological methods. In our setting, it is very challenging to treat our patients' pain due to their substance use disorder history. We're very limited on what we can administer and treat our patients with for their pain. Pharmacological methods have been the choice for pain management for the past couple of decades. With the use of opioids increasing the risk for addiction with the euphoric effects they create, our country is now dealing with an opioid epidemic. In 2013, the state of Oklahoma put into place a set of recommendations by the Oklahoma Board of Nursing, the Oklahoma State Medical Association, and the Oklahoma Mental Health and Substance Abuse Services for prescribing of opioids to treat pain. Those recommendations are now Oklahoma Law 630S2309. With those laws being put into place, it pushed healthcare providers to consider non-pharmacological therapies and treatments. Cognitive behavioral therapy, also known as CBT, has been an effective treatment for pain reduction and management. Cognitive behavioral therapy can aid in changing one's behavior. With pain being influenced by an individual's personality, according to Cordier and Deer in a 2018 article called Learning and Unlearning Pain, learning mechanisms can explain why pain experience and pain behavior can increase and decrease. Cognitive behavioral therapies are used to manage pain by attempting to change negative thoughts about pain and introduce behavior modifications to improve functions and cope with pain. Pain can be debilitating and also frustrating while causing challenges in the everyday individual's activities of daily living. It is not only important for us as healthcare providers to provide the best evidence-based care available, but it is also the patient's right to have their pain managed to the best ability possible. Cognitive behavioral therapy is said to help identify, tackle, change unhelpful thinking so that the mindset, behavior, and overall well-being improves with practice. With addiction being formed from behavior, cognitive behavioral therapy for pain treatment is in addicts is very beneficial. I've often had my patients tell me that they just wake up and their first thought is they have to go and get high. Well, this is a behavioral. So cognitive behavioral therapy can assist in emotional thoughts and behaviors, and it is effective for a wide variety of maladaptive behaviors. Cognitive behavioral therapy is one of the most well-studied forms of treatment and has been shown to be effective in the treatment of a wide range of conditions such as pain, amongst many other conditions like depression or anxiety. Cognitive behavioral therapy is a psychological therapy that has been used to improve a patient's health well-being across multiple mental and physical health problems and pain. So I proposed a PICOT question of in managing pain in the addict, how does pharmacological methods such as opioids compare to non-pharmacological approaches such as cognitive behavioral therapy affect pain? For evidence of the effectiveness of and use of cognitive behavioral therapy, I performed a literature search of well-organized published data to identify good quality references on specific topics using various databases such as EBSCOhost, Sonal, ProQuest, ProMed, and Google Scholar, amongst other databases. Some of the keywords and terms used were pain, pain management, pharmacological methods, non-pharmacological methods, cognitive behavioral therapy, opioids, and addiction for my search purposes. The results yielded over 1,107 articles, books, and journals between all the databases. An inclusion and exclusion criteria was applied with the inclusion of adults 18 and over with a history of substance use disorder, including opioids, alcohol, benzos, and not limited to prescribed medications for the treatment of pain. Excluded were any studies with individuals younger than the age of 18. Several randomized controlled trials were located during my literature research for cognitive behavioral therapy on pain. Pain is affected by individuals' cognitions as well as tissue injury, and the core premises of cognitive behavioral therapy is maladaptive cognitions to maintain behavioral. Pain erodes the health and quality of life and causes tremendous burdens for families, patients, and also caregivers. Cognitive behavioral therapy has been shown through literature to improve clinical outcomes. Cognitive behavioral therapy is safe and it reduces pain, severity, and sensitivity in the substance use disorder individual. It has been determined to be effective when compared to pharmacological methods of pain management. Using a quantitative study to gain knowledge and understanding of cognitive behavioral therapy through studies collecting data proving the statistical success of cognitive behavioral therapy and pain management, I will utilize Johns Hopkins appraisal tool for my proposed evidence-based practice. As Johns Hopkins model takes a problem-solving approach with clinical decision-making using practice evidence and translating it into practice. The organization that I currently work for has a very open door policy. Administration is open to suggestions and recommendations with a drive to do better. They always have an open door policy. The population of patients served at my facility are all recovering or recovered adults. When an individual uses substance, it can mask pain, emotions, and other feelings. Once they stop using the substance, all those feelings of pain and emotions return. It is imperative for them to learn to deal with the emotions and behavior in order to achieve pain relief. Cognitive behavioral therapy is beneficial in this process. I will present evidence of the benefits of using cognitive behavioral therapy to manage pain as learned through my research with documented evidence. I will propose that incorporating of cognitive behavioral therapy in a small group of patients suffering with pain over an 8-week period with weekly sessions 2 days a week while using the Johns Hopkins appraisal tool designed to ensure the latest research findings and best practices are incorporated into the patient's care. CBT core competencies is recommended by the Department of Health. With the proven effectiveness of cognitive behavioral therapy through evidence-based research, the utilization of cognitive behavioral therapy can provide a more holistic pain management. Although there is plenty of research proving cognitive behavioral therapy, it is not widely used for pain management. It is also limited access for individuals with cognitive behavioral therapy. This continues to create a gap that exists with pain management standards in healthcare, requiring continued research on cognitive behavioral therapy utilization for pain management. Thank you. That is the end of my PICOT.